Proper insulin injection technique is critical to managing your diabetes. Whether you're new to injecting insulin or just want a refresher, I think you'll find this video demonstration will make you more comfortable with the process. I'm going to cover the basics of how to inject insulin with a pen and pen needle. But if your doctor has suggested a different method, always follow your doctor's instructions. For this demonstration, I'll be using an insulin pen and a BD 4mm 32 gauge pen needle with pen-to-point comfort, and I'll be giving myself 43 units of insulin. This is only an example, so be sure to check with your doctor to determine the needle, pen, and insulin dose that are right for you. First, gather all your supplies on a flat surface. You'll need your pen, pen needle, 2 alcohol swabs, and a sharps container. After washing your hands with soap and water, open the alcohol swabs and place them on top of the packages. Before I continue, I want to make sure you're familiar with the pen and pen needle. Insulin pens are designed for multiple uses, based on the dose and schedule ordered by your doctor. But a pen needle should only be used once. A new pen needle should be attached to the pen each time you give an injection. The pen needle has a paper tab, an outer shield, inner shield, and needle. Insulin pens have a pen cap, an insulin cartridge, a rubber seal, a dosing indicator, and a dosing knob that doubles as an injection button. You should really take the time to read the full detailed instructions that came with your pen. If you have any other questions, call your doctor's office. If you take more than one insulin, or this is the first time you're using your pen, check the label to make sure you're using the correct medication. To attach a new pen needle, first pull the cap off the pen and set it aside. If you're using a cloudy insulin, gently roll the pen 10 times and then flip it upside down 10 times in order to mix the insulin. Once you're done, it should look evenly mixed. Then, wipe the rubber seal of the end of the pen cartridge holder with one of the alcohol swabs. Now, pull the paper tab off the pen needle. Hold the pen horizontally and attach the needle by pressing it into the end of the pen and twisting it in a clockwise direction. Once you feel a little resistance, stop. There's no need to over-tighten. Pull off the outer shield of the pen needle and set it aside. You may need it later to remove the pen needle. Pull off the inner shield and then discard it. You always want to prime the pen before each injection. This means you will dial the dose to 2 units of insulin and then press the button. You should see a drop of insulin at the end of the needle when you do this. Priming also removes air bubbles, which helps you get an accurate dose. Now, you're ready to dial your dose. Check that the dose window is displaying 0 after your pen is primed. Then, adjust the pen to the correct number of units for the dose you need. In this case, we're injecting 43 units. If you turn past your dose, just turn it back down to the correct dose. Insulin pens can be set in 1-unit increments, up to a maximum of 80 units. If you need more than 80 units, you'll need to do 2 or more injections. Next, you need to select your injection site. Injection sites include the abdomen, back of the arm, upper buttocks, and outer thighs. It's important to rotate your injection sites. Move the site down by a finger's width with each injection and change to a new site each week. Now, with the second alcohol swab, clean the area of the skin where you plan to inject. Start in the middle of the site and then, moving in a circular motion, clean the whole area. To reduce any stinging, be sure to let the alcohol on your skin air dry completely before you inject. If you use a pen needle 6 millimeters or longer, you may need to pinch up a skin fold to avoid injecting into muscle. Using your thumb and other fingers gently, not too tight, pinch up an area of the skin within the injection site. Then you would inject straight in at a 90-degree angle. Since I'm using the BD 4mm nano pen needle, a pinch up isn't required. I can use the single-handed no pinch technique that allows me to reach more injection sites. So, with the BD Nano Pen needle attached, grip the pen in the palm of your hand and in one continuous motion, insert the needle into the flat skin at a 90-degree angle. Then press and hold the pen's injection button and count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This ensures the entire dose of the insulin has entered your body. And that's it. If you have a BD Sharps container, you can use the special opening at the top of the container to unscrew the pen needle from the pen. If your container doesn't have that kind of opening, first, cap the needle with the clear outer shield. Then unscrew the pen counterclockwise until the needle separates from the pen. Discard the used pen needle in a Sharps container. And remember, never reuse pen needles. Be sure to check with your sanitation company or health department regarding the rules for safe disposal of used needles and Sharps containers. That wasn't so hard, right? But it's really important. Proper insulin injection technique helps better glucose control, which is critical in managing your diabetes today and over the long term.